It is coronavirus day 413 lockdown to day 27. It's the second last day of the lockdown, so we just have literally a week until stay at home rules that are like literally over. However, we have high cases, and there's something I want to talk about. And another thing I want to talk about, I mentioned yesterday about patients being transferred, and yeah. So I do not really like the sound of this. So anyways, we have 3,871 coronavirus high cases, higher than yesterday's. Okay, pretty standard. And they apparently today's report is that 1,170 to really high cases are from Toronto. So Toronto, like in dangerous cases again. So yeah, I don't really like this idea of yeah, and it's this high and Peel region is at a ridiculously high 901. So it's literally 99 away from 1,000. So as usual, Peel region is catching up to Toronto. 392 two is from York region, and 292 is from Durham region. So all other regions have reported under 200 cases. 41 deaths have been reported today, and of course we're going to have to talk about UK variants. The variant cases. Okay, so which really yeah, I hate talking about it, but the UK variants are now at 62,944. It's the plus 2,589. 243 South African variants, which is the plus 23. 501 Brazilian variants, plus 96. And the India double mutant variant has not changed. Which brings me to my concern, topic 1. So apparently, I read this yesterday. So apparently, it's disappointing absolutely disappointing that the Ontario government is not in the process of developing a mass screening technique to detect the India double mutant variant because they didn't label it as a variant of concern and instead labeled it as a variant of interest. So it's not concerned to be more infectious and requiring further study. And but however, there's been a reports so instead instead, the province is continue to rely on random sampling of positive cases of COVID-19 run through an expensive and lab process known as whole genomic sequencing. So WGS, and so if however, it has been reported that the government's not even trying to develop a PCR based screening for the India double mutant variant. So they're running 5% of samples that test negative for the whole specimen spike protein mutation and found in the UK variant and the South African variants. Do the whole WGS sequence thing, and apparently they're doing research at the National Microbiology Lab in Winnipeg. So they're just going to waste their time doing that, and they're not going to do the same thing they did to the UK variant and the South African variant and the Brazilian variants. So it's variant to the variant. It's more contagious and more So not to mention the India double mutant variant is if you look at the India news right now, in the some people. It is going crazy right now. People are dying, and they had to burn some bodies. And oh my god, I don't want. Yeah, I know, burning patients' bodies. Because they can't cure them. So apparently Canada, they blocked all flights from India to direct flights from India and Pakistan since the April 22nd. But however, they didn't. What they didn't do is they didn't block direct, connecting flights from India and Pakistan because these people could, and from India and Pakistan they could easily go through an airport from their airport there to maybe an airport in Incheon Airport in South Korea, or take the one that went to Tokyo Airport in Japan, or the Beijing Airport in China. And those are the three potential airports they could use as connecting flights. And since Canada did not block any flights from these airports, or in the surrounding Asia airports in these surrounding countries, look what they could be doing. They're bringing the India double mutant variant into the country. So, and it's just disappointing that they're and India's infections right now is over 300,000 new per daily, though it's ridiculously high. and this is why Ontario's Premier Doug Ford and the Brampton, since the UK, the India double mutant variant has been reported in Brampton. So the Brampton Mayor Patrick Brown has both of them have requested to call for new restrictions on air travel, and also Brampton Mayor Patrick Brown has requested essential workers be vaccinated right away. So instead of having to make them wait because their age isn't eligible, or they don't live in a hot spot. Because they have this special postal code hotspot thing. But the issue with that is it doesn't even have to be a special postal code area or zip code. No, it could affect an entire town or city, or depending on the activity of the people in that town or city. And of course, since they're transferring ICU patients to places where yeah. So a Toronto woman said, so her family was forced to pay a private company to bring her uncle's body home after he was transferred to a hospital, the Ottawa, probably most likely the Ottawa Hospital, the one next to Children's Hospital, Eastern Ontario, that one, and he died there of coronavirus. So Jamie Nguyen said in an interview with CTV News that so we don't know anyone in Ottawa. We don't have family there. All our family is here in Toronto. His support system is here. So what happened was that Jamie Nguyen's uncle died of coronavirus a week ago, taking his last breath alone and in a hospital hours away from his loved ones. And Ottawa is about 4 hours and 15 minutes away. 4 hours 30 about, depending on what part of Toronto you live. So she said dying alone, far away from his family with an indignity. She never thought her uncle would have to suffer, at least not in Canada. Because so she said her uncle immigrated to Canada in 1975 as part of a wave of Vietnamese refugees. So CTV News is not identifying the man's name because of possible anti-Asian backlash. Because anti-Asian, it's heavy right now. So he was the 17-year-old man was being. Though her uncle was being treated at the Scarborough General Hospital in Toronto after he got contracted for after being tested positive for coronavirus. And then they said there was no room for him in the ICU after symptoms got worse. And he got transferred to the Montfort Hospital in Ottawa and died there. So, being an Asian, I can understand the pain. Yeah. So they were trying to figure out how to get a body. So they literally had to. But the unfortunate thing right now, they had to do. They had to pay $1,062 out of a private through a private transportation to get his body back from that Montfort Hospital in Ottawa all the way back to Toronto, and of course. So the hospitals are literally 400 kilometers apart. And this is not the only problem we have to feed. And also hospitals in Ontario are also are literally without consent are transferring patients to a long-term care home. And only if the hospital's medical team thinks, yeah, and they're making the decision that yeah, so however, the issue is with that problem was some people that don't want to be put in that long-term care homes, and sometimes that they don't in long-term care homes they don't receive the proper care, and not to mention long-term care homes have had high cases for the past few days for before which was literally a week ago before they stopped reporting long-term care home numbers. I don't and outbreaks. It's like the government is literally trying to hide that information from us. I don't like that. So if a patient is being transferred, I think that they should be actually should family should be notified before being transferred. But the problem is the patient. How are you going to bring them back after maybe they recovered? How are you going to bring them back? Or maybe if they died, how are you going to bring that person's body back, dead body back? Or how are you going to arrange for transportation to come back? And I do understand that nurses have been stressing out, like because even though like that I've heard, like the word mentioned from the nurses at Humber River Hospital, which is right between North York and Etobicoke. And some nurses have bailed or because or had burnouts or because they couldn't it was too much for them witnessing patients dying even though they did their best. So just randomly like without their consent, yeah, they're transferring parents patients. I disapprove of this idea actually. Anyways, okay. If you want to get vaccinated, yeah, you must be 40 or 40 years or older, either pregnant, have special needs like me, or you're an educational worker in a coronavirus hotspot, which is pretty much designated. Yeah, please check. So you can book online at www.ontario.ca/book vaccine, or you can book or call the toll-free number at 1-888-999-6488. Lockdown ends tomorrow. Tomorrow is the last day. After that, we're free. So once it becomes Saturday, no lockdown. Only stay-at-home rules that focused on. I will upload the stay-at-home rules as usual. If enforcement officers have the authority to break up gatherings, and there will be fines at $750 each for all lawbreakers who do this. And organizers of these events will be charged $10,000, and also there is an additional $130 surcharge for those who break who have gatherings of any kind or activity. So, or fishing or trying to do anti-lockdown, yeah, you'll be charged $750. You do the math. $750 plus $130. Just be patient. So hospitalizations, okay. So hospitalizations is at 2,248 people hospitalized with coronavirus, minus 33. And unfortunately, it's a new record of ICU patients at 884 plus 7. And 620, a new record of ventilator ICU patients using a ventilator, which is a plus 15. There is no reports on long-term care homes deaths or outbreaks. Too. It's been 1 week since they've done that, I think. So please follow coronavirus safety rules and regulations, lockdown regulations, and stay-at-home rules. Don't have any gatherings. Gatherings. Just having gatherings just makes it worse. It's like taking a step back from trying to get out of coronavirus, and then you're getting more into coronavirus than being free from coronavirus. So please, if you're going across the Ontario-Quebec border for essential reasons, please follow both Ontario and Quebec border rules. Check my previous videos. So remember, your rights aren't more important than the rest of us trying to lower coronavirus cases. And ICU patient numbers, and don't forget the new India double mutant variant that is threatening us right now. So, stay safe. Hopefully, Justin Trudeau will actually get through with the actual starting monitor for the India variant. Because if the Mayor Patrick Barron and Premier Doug Ford is pushing him to do it, why don't he? This is when I want to say screw the government sometimes. So, and I know some people might think, you're supporting the government. No, I'm just a blogger. I'm just a citizen just like you. But there's rule that really affects a lot of people in a negative way. Even though rules are rules, I know something needs to be done about it.